Today we are gathered here to create awareness about the 2024 Lymphatic Filarias and Onchocercis Integrated Mass Drug Administration. I'm sure most of you are familiar with this exercise which happens annually. When we talk about neglected tropical diseases, we are talking about diseases that can be prevented and treated. These diseases, they also disfigure and disable people, keeping children out of school and parents out of work. They are commonly found in poor communities and promote poverty and a very, very intense stigma. Kids are kept hidden and others hide themselves because of this disfigurement. Ladies and gentlemen, the human Onchocercis, its real name, the river blindness, is a disease of the skin and eye caused by the Onchocerca bubbles, a parasitic worm that is actually called the black flies. They breed in fast-flowing rivers and streams, and I must give an example of maybe the Ancobra, the Pra, and the Volta region. When they get into the valleys and the rivers are flowing very fast, that's when these black flies breed, and that's where they also do the transmission. The disease is endemic in 31 countries in the sub-Saharan Africa, including Ghana, and is also present in the countries in Latin America and Yemen. In Ghana, ladies and gentlemen, about 140 districts are endemic with this Onchocercis, or say the river blindness. And the mass administration has been initiated. We've been doing this since 1997. We have made considerable progress so far in the control of this Onchocercis, but there's still a lot of tasks ahead to achieve the global target of eliminating these diseases by the year 2030. Our main strategy of the control is by interruption of the transmission. That is true by treating people with the parasite. You are able to reduce the parasite load so that the chance of picking from one person to another is reduced or eliminated, and that's the strategy. And so we do that by doing annual mass drug administration and using the community-directed treatment with ivermectin strategy. And now with our pilots, we may, once it goes on, we may have a more effective medicine to also apply. Lymphatic filariasis, commonly known as elephantiasis, occurs in the Filaria parasite as transmitted to humans through the infected mosquitoes. And that's another parasite that entity that we're dealing with. This infection is usually acquired in childhood and causes hidden damage to the lymphatic system. What is the lymphatic system? These are small tubes or pipes that will return fluid from the blood back to the blood. As it moves down there, it just filters out, and then the body has a way of bringing them back. So the painful and profoundly disfiguring visible manifestation of the disease, that is swelling of parts of the body, including your legs, the scrotum, among others. Later, these patients are not only physically disabled, but suffer mental and social and financial losses, contributing to stigma and poverty. Lymphatic filariasis is endemic in Ghana in about 116 districts. And currently, transmission of the infection has been interrupted in about 109 districts already through other strategies, including the mass drug administration. The main strategy for this control elimination of lymphatic filariasis includes, as I said earlier, stopping the spread of the infection through a large-scale annual treatment of all eligible people in an area or region where infection is present, and alleviating the suffering caused by the lymphatic filariasis through the provision of recommended essential package of care. As part of the process of eliminating both onchocercis and the lymphatic filariasis by the year 2030, The Ghana Health Service, working with our partners, the NTD program, is implementing this year's Mouse Drug Administration in 77 Onchocercis endemic, that's the river blindness district, which occurs in almost all the regions of the country, and targets to reach about 5.8 million people and 3 lymphatic filariasis endemic districts that are occurring in 3 regions, targeting about 440,000 people at risk. This activity commenced from July 15 to 20 to 26 of this year. As you can see, through the Mouse Drug Administration, we've been able to reduce transmission in a lot of countries for a lot of districts for lymphatic filariasis, but we still have a large challenge with onchocercis. So preventing and control of NTD is central to ending extreme poverty in the next 2 decades. The river blindness and lymphatic filariasis, 2 of the entities, can be targeted through a highly effective integrated community treatment approach using drugs that have been proven safe and effective and can be delivered by trained non-health personnel. This approach, known as the Mouse Drug Administration, provides a single dose of medication to all eligible individuals once or twice a year. It's been implemented over 3 of the 7 years. MDAs have significantly control the burden of NTDs, and in some cases, elimination can be achieved. As we launch the Mouse Drug Administration today, let us encourage all eligible persons concerning the need for NTD medicines in the fight against onchocercis, lymphatic filariasis, and other neglected tropical diseases, and rid our society of these infections that cause poverty and stigma. I would like to express my sincere appreciation to all the health workers across the levels of the service for their continuous dedication to the elimination of NTDs. I also want to appreciate the support we get from the USAID, the American People of America, and other partners, WHO, for technical support, and as we continue our march towards eliminating all these NTDs. Finally, to all the community drug distributors and other volunteers, we say a very big thank you, because they work from house to house and identifying vulnerable people and providing them with the medication. On this note, I declare the 2024 Onchocercis and Lymphatic Filariasis Integrated MDA duly launched.